Hi, this is Colleen Parsons with part 2 of your ear assessment lecture. And I stopped part 1 a little bit early, so we have to pick up a few extra questions here. We have to pick up a few subjective questions here, one of which is on environmental noise. So what kind of loud noises are constantly going on in the home or the job site? Job is usually more important than the home site, unless the person is addicted to very loud music or using earphones. Now, there are two problems with earphones. One is that they for the most part, stop the circulation of air in the ears, and that can be a significant problem and may cause infections in the ears. The second thing is the noise, the vibration that it's causing in the ear can actually wear the ear out. So other loud noises would be jackhammers, transportation vehicles like loud trucks, airways, airports, those sorts of things, and heavy machinery, gunshots. It isn't the occasional gunshot while hunting per se, it is more the sighting in, the repetitive, loud shots all of the time, or over a period of time. So what steps do people take to protect their ears? Do they use headphones? When my husband is using his chainsaw or any loud machinery like that, he'll wear headphones, or he has protective earplugs that go in his ears. A lot of workplaces provide them for free, and you're expected to wear them. He uses them when he's mowing the lawn as well. So again, tinnitus is a ringing, crackling, or buzzing in your ears. It's very difficult to explain what it sounds like, but if you've gone to a music concert and that ringing that you hear afterwards is kind of what mine is. It's a cross between a buzzing and a ringing, I guess. And does it seem louder at night? Well, it does seem louder at night, and that's because I don't have any other distractions going on. If it's very quiet during the day, it bothers me as well. And then vertigo that we're talking about here is a little bit different than dizziness. The vertigo is that the room is spinning around, or you feel like you are spinning, which is a little bit different than dizzy, because dizzy is a very more short term, and it's more of an equilibrium, like I just feel like I might fall down. Vertigo is the spinning around. So dizziness, here it's saying lightheadedness, and that's probably a really good explanation. Self-care behaviors, and this is a crossover question between the subjective information and the objective information. So how do you clean your ears? And the Q-tips, as you all know, are the biggest problem. In children, one of the big problems is putting things in their ears. Oh man, you take an orifice in a small child and they're going to put something in that orifice. So if you have any hearing loss, do you use a hearing aid? How does it work? Do you have trouble with the upkeep? And do you have trouble changing the batteries? I got to tell you, those batteries are so itty bitty, especially in the newer, more advanced hearing aids. They're so tiny, it can be quite difficult for an aged person, especially if they have any sort of a tremor, to change those. Ear infections. Again, it isn't just the ear infection, but we're looking at any other head neck surgery that may have impacted the ears, and we are looking at ear tubes. Have they ever had any tubes in their ears? Now, we should be able to see some videos in class, and I'll see if I can put them on here as well, and from YouTube as well, but that's an issue. Now, is there anybody smoking? Because that can impact ear infections as well. That tar goes everywhere. Excuse me. And knowing that tar goes everywhere, including inside your ears. Additional history for infants and children. If you notice that they're not hearing well, please get them checked out immediately. Certain diseases or colds or can impact hearing. Objective data preparation. All we're really going to need here is the otoscope, and that should be it. Oh, I'm sorry, the tuning fork. Okay, for inspection, we're going to inspect the outside of the ear, the size, shape, and the what? The symmetry between the ears. Are you seeing any lesions? When you go and you begin to palpate the ears, is there any tenderness or pain associated with that? You're looking at the skin condition, you're looking for any lumps, you're looking for any drainage out of the ear. And let's see. Then you're going to go into the ear with the otoscope and actually look in their ear. You want to use the largest speculum, which is that black tube that fits on the otoscope, in their ear. You're going to be lifting the pinna and slightly away from you. Wait a minute. Good. Tilt the person's head slightly away from you, and then you're going to pull the pinna up and back on an adult ear and older children. But when you're using children under 3, because of the shape of the eustachian tube, you're going to pull that down. Okay? Hold the pinna gently but firmly. Do not release it until you've actually taken the otoscope speculum out of their ear. You don't want to go too deep. Some of our speculums are kind of long. You don't want to go too deep in there because you're going to hurt the inner ear. So you're going to inspect carefully, looking along the axis of the canal, looking, really what you're looking for is to see if there's any waxy substance in there, and you're going to be looking for the tympanic membrane. So this is how you do an inspection of an inner inspection of the adult ear. You're going to look for any redness, swelling, lesions. The tympanic membrane, it's going to be shiny, translucent with a pearl gray color. That's probably an answer on your quiz or test. And you're going to be looking at the position of the tympanic membrane and the integrity of the membrane. If there's any scarring, it might be that either the patient has had repeated ear infections or they've had tubes put in their ears. And if it's a straight line, scarring will look like a white line or white squiggles on the tympanic membrane. And if there's a straight line, then that's usually an indication that they've had tubes. We're going to test for hearing acuity in a couple different ways. How well does the person hear with conversational speech? Just by you talking to them, do they appear to have any hearing loss? Then we're going to do the whisper test, and that is depicted in Dr. Waglam's video, but we'll go over that in class as well. The deal here is that you don't want people to see your lips, and you've got to have them close one ear so they can't accidentally hear it through their good ear. So you would have them press their tragus on one ear, whisper in this ear, and then come over to the other ear and have them repeat what you said. Come over to the other ear, press the tragus in, have them whisper something to them, and then see if they can repeat it. And the very best way is when you have them repeatedly pressing on the tragus, because that causes interference in this ear and allows that ear to hear. So it's a more accurate test. You want to be behind the person or whispering so that they can't see your mouth. Tuning forks test. I don't know. Here's what the I can't remember which is which. I think this is the Weber test when it goes on top of your head. And you're looking for conduction hearing here. Then the Romberg test is more of a equilibrium test when the patient stands in front of you with their eyes closed and you push them, or actually you're not pushing them at all, I think, in this test, but you're just standing there supporting, ready to support them, see if they wobble one way or the other. And in more advanced Romberg, you would slightly, very gently push on your patient to see if they can correct their equilibrium. And that's the end of part 2.